the ear, and we have three parts to the ear. The external ear, which is involved in only hearing, the middle ear, which is involved in only the hearing part of the function, and then the inner ear, which is both hearing and equilibrium. Okay, some anatomy. So the outer ear is the auricle. You may also read pinna. Then we have the external acoustic or auditory meatus, and then the tympanic membrane, which is in lay terms the eardrum. And then we have the ear ossicles, the malleus, the incus, and the stapes in order. And then the oval window right there, round window there. Okay. You'll notice the stapes is communicating directly with the oval window. And then if you look at this, it looks like a snail. We'll just call him Turbo. And if you haven't seen the movie, then you don't know what I'm talking about. Okay, the snail body is the cochlea. If you'll notice, the cochlear nerve comes in, so the cranial nerve 8 would come in like this and split. Part of it goes this way, which is the vestibular part of the nerve, and the other part goes this way, which is the cochlear part of the nerve. Cochlear part goes to the cochlea, which we'll look inside in just a minute. That one is responsible for hearing. Then we have the vestibule, which would be the neck of the snail. So the cochlea is the body, and then there's the neck. And from this area, sound waves are being directed through the vestibule into the cochlea, and also up in here, the semicircular canals are going to be responsible for balance and equilibrium. Okay, also this is the auditory tube, also known as the eustachian tube. Okay, the external ear also contains the ceruminous glands. Okay, we mentioned the other ones. The ceruminous glands are what produces your earwax. Okay, the middle ear, actually let me go back, let me show you something. Okay, here's the external ear, so there's your divisions. And then here's the middle ear, so it shows you the divisions there. And then here's the inner ear. So right from this point, so basically the posterior part of the tympanic membrane and this way, external ear. And this little cavity there, middle ear. And then all of this, inner ear. Okay, the middle ear is also known as the tympanic cavity. I'm listing the directional components here, so make sure you read that. For example, in the middle ear, if you go lateral to it, that's the tympanic membrane. If you go to the medial side, you'll find the oval window. And then if you go down or inferior, you find the eustachian tube. Okay, this area is necessary for drainage and equalizing pressure. Very, very important for drainage and equalization of pressure. Pressure on both sides need to be equal for proper hearing to occur. And when pressure is unequal, the tympanic membrane could bulge inward or outward. Okay, now that's very important, because when unequalization of pressure sets in, that is not an infection. It hurts, that's ear pain. It can make the eardrum bulge, it turns red, but it's not an infection. So what I prefer and the techniques to get the atlas off of the eustachian tube, which is very common. Usually when the atlas translates, it kinks the eustachian tube, which begins the inhibition of equalization of pressure. So you have to realign the atlas and then adjust the ear. So let's go back to the ear. Let me show you something. So look at the soft tissue here as it connects all the way to eustachian tube. So under this area we'll get atlas off of the tube, and then to open it up quicker you do an ear adjustment to get that pressure to change, and it is quick. It's very quick. No drugs, no antibiotics, no infection, no nothing. You just prevented it. It goes away, usually very quickly. Now, if I get someone that has been 10 days, it's been sitting in there a long time, then yeah, now that can turn into a problem. But when it first sets in, it's not an infection. It's just pressure. And if you all have ever gone deep into the bottom of a pool, or you go to the top of a mountain or airplane stuff or whatever, it hurts if, as that pressure's setting in. Like if you go to the bottom of a deep pool, as that pressure's setting in, if it doesn't stabilize or equalize, it hurts, it hurts, it hurts. Okay, that's not an infection. As soon as the pressure equalizes, you get relief. You feel better. Okay, so that's my job, and that's what I do for the kids and all those that come in. I've got a lot of parents that bring me their kids. They come here first because they know that we're going to fix the problem and it goes away within a day or two, versus just the kids getting on antibiotics. Okay. Okay, now ear infections can result if this is left unchecked. Okay, so when I look in someone's ear, I can tell for the most part if there's an infection setting in or not. Sometimes you look in, it's like absolutely not. That's not an infection. It's just pressure right now. Sometimes you look in, it's like, oh, yeah, it could go either way. And then sometimes you look in, it's like, yeah, that's a bona fide infection. Okay, so certainly if it's a bona fide infection, I'll send them out so that they can get the proper medication treatments. And then after that, we'll talk about how to prevent it for next time. One of the reasons why kids get ear issues more so than adults is because of the orientation of the eustachian tube. In youth, let's go back to this picture. In youth, the eustachian tube is more horizontal. So infants, toddlers, little kids, the eustachian tube is more horizontal, which means it's more susceptible to getting kinked. Feeding is a big one. If mom is breastfeeding or bottle feeding and they're holding their baby too horizontal, then that can cause some problems. Okay, so an oblique position is better for feeding rather than a completely horizontal position. Okay, as you age, this horizontal eustachian tube drops down and becomes more vertical, like you see here. So this would be an adult eustachian tube, and those are less likely to get kinked because of their orientation, but they can still get kinked, which means equalization of pressure is off, which means your eardrum can bulge, which means that hurts. And my job is to fix that through manipulations. Okay, a myringectomy is where they give an ear tube. So the medical version of getting that bulge to settle down is to puncture the eardrum and put an ear tube in. Okay, personally, I'm not a big fan of that. I think that should be an absolute last result. But oftentimes that's just the first go-to. Okay. Okay, the middle ear contains the malleus, the incus, and the stapes. In lay terms, they're the hammer, anvil, and stirrup. When sound waves hit the ear, they irritate the tympanic membrane, which then sends vibrations to the malleus, the incus, and the stapes, which presses on the oval window, which sets the fluid in the inner ear in motion, which excites the hearing receptors. So now we're getting ready to get into the inner ear where we're going to find this fluid. So here's the cochlear part, or here's the entire inner ear. This is the snail itself, that's the inner ear. The different components of the snail do different things, which we'll talk about. It is deep in the temporal bone, and this is behind the eye socket. Like, this is deep enough where it goes directly behind the eye socket. It is considered a bony labyrinth, and it's divided into three parts: the cochlea, which is here, the vestibular part, which is here, and the semicircular canals. Okay. There's perilymph inside, so here's the inner ear part, the cochlea and all that. So when we go in and look at the copula of crista ampullaris, which is this part here, or the ampulla part, there's a lot of lymph in there, a lot of fluid, the endolymph. When sound waves come in, it sends the fluid in motion, which causes the copula to move, which irritates the nerve hairs, which sends a signal down the cranial nerve 8 so that you interpret sound. Okay, equilibrium or balance depends on, that's a lot of stuff. That's cerebellum, that's your mechanoreceptors, your proprioceptors, your Golgi tendon organs, your muscle spindles, the inner ear, vision. There's a lot of things that come together to make balance. Make your balance work. So the vestibule and the semicircular canals are going to be a huge part of the ear's component and what it contributes to your balance. The vestibular apparatus is an AKA for the equilibrium center of the ear, and is divided into two functional arms. The first arm is static equilibrium, which means when you're not moving, you're still balanced even though you're not moving. For example, just sitting there, you're not really moving in the sense of like riding a bike, doing gymnastics, skiing, that kind of thing. You're still balancing even though you're static. And the second arm is dynamic, which means you're balancing with movement, like skateboarding and biking and things like that. Okay, static equilibrium is, to some degree, that's a little bit easy, because as long as you're sitting there with the pull of gravity on your body and the position of your head with that respect to the pull of gravity, you know where you are in space. This is what helps keep our head erect. This is what keeps our eyes level to the horizon. And the hairs that are in the macula, these otolithic hairs, or the crystals, as some people will say, that are in there, these are set in motion. These tiny calcium stones, these otoliths, are set in motion. So when your head moves, the otoliths roll in response to the change of gravity, which pulls on the gel, which in turn slides over the hair, which sends an impulse down the vestibular part of cranial nerve 8 to the cerebellum to tell you where you are in space. Okay, here's an example of that. So this person's just sitting there, and they simply look down at their paper, and because of gravity and all that, the otoliths that are inside the membrane here, they move because gravity moves them, which irritates the hairs, which sends a signal down cranial nerve 8, which now you know you are looking down. You're aware of this. Up here you can see the otoliths and the otolithic membranes, and there's the tuft of hairs, the nerve hairs, and branches of cranial nerve 8, the vestibular part. Okay, dynamic equilibrium is in motion, and when you're in motion, the semicircular canals are going to kick in, And this is in response to angular and rotatory movements, twirling, anything that's acrobatic, so to speak, riding your bike and all that, things that require balance with movement. And they're oriented in 3 planes, which is going to help you detect your movements of where you are in space. So like, for example, a gymnast, as they're doing their twirls and backflips and stuff, they know where they are. Especially the more highly developed they are, they're absolutely aware where they are. Okay, within the semicircular canals, you're going to have, it's the same concept with the fluid. Okay, the fluid is set in motion, and when it's set in motion, it is going to communicate to the cerebellum via the vestibular cranial nerve 8. Okay, in the hearing part, this is found in the cochlea. The functional part of hearing is the organ of Corti. As you can see in here, the organ of Corti. So as sound waves are coming in, it's going to irritate the fluid, which is going to irritate the tuft of hairs, and that will send its signal down cranial nerve 8, the cochlear part. To the auditory cortex, where you're going to interpret the sound.